A government shutdown affects healthcare. Democrats take control of the House, and AJMC names its most influential person in healthcare. Welcome to This Week in Managed Care. I'm Laura Jost. The new year began with a government shutdown that affected public health. President Donald Trump's standoff with Congress over funding for a border wall meant that 41% of the FDA's staff was furloughed the day after Christmas, while essential activities to handle drug shortages, foodborne illness, and infectious disease continued, said the American Public Health Association's Dr. George Benjamin. The administration and Congress's inability to approve funds to keep the federal government open is unacceptable and poses a threat to public health. This shutdown is a political failure, and AHPA urges the government to put ideology aside and reach a funding solution as soon as possible. Wednesday marked the start of the 116th Congress as Democrats took charge of the House of Representatives for the first time since 2011. Congressman Frank Pallone of New Jersey becomes the chairman of the House Energy and Commerce Committee, which handles major healthcare legislation, and has said that he hopes to reverse steps by the Trump administration and work on controlling prices for prescription drugs. He recently told Roll Call, "Our priority has to be stabilizing the Affordable Care Act, preventing the sabotage that the Trump administration has initiated." For more on what will be coming in the new Congress, visit AJMC.com. Drug approvals, the future of biosimilars, and the effort to make pharmaceuticals more competitive and affordable were all big healthcare news in the past year. So it's no surprise that AJMC readers selected FDA Commissioner Dr. Scott Gottlieb as the most influential person in healthcare in an online survey. Among the many initiatives that Gottlieb announced during 2018, he played a major role in American Patients First, President Trump's plan to rein in the cost of prescription drugs. He announced the Biosimilars Action Plan to bring more competition to the market, and he is taking action against manufacturers of smokeless tobacco who market to kids. CMS Administrator Seema Verma and Amazon CEO Jeff Bezos were tied for second as the most influential in the online poll. For more, visit AJMC.com. A federal judge has blocked the Trump administration's cuts to the 340B drug discount program, ruling that the administration acted illegally when it reduced Medicare payments because it acted against Congress's intent. The rule, which cuts payments 30%, was designed to reduce seniors' pay out of pocket for prescription drugs. Hospital groups that use the program argued that the new rule threatened services that they provide to the poor. Groups said in a statement, "For more than 25 years, the 340B program has helped hospitals stretch scarce federal resources to reach more patients and provide more comprehensive services. This was Congress's clear intent for the program. The court's ruling will help ensure 340B can continue supporting access to affordable health care for our most vulnerable communities." But groups like the Community Oncology Alliance have argued that some hospitals use the 340B program at affiliates that do not serve low-income populations and put community oncologists at a financial disadvantage. Finally, the new issue of evidence-based diabetes management examines the paradigm shift that has occurred in diabetes care over the past decade with the rise of cardiovascular outcomes trials. In the past year, the American Diabetes Association, the American College of Cardiology, and the American Heart Association have updated guidelines on hypoglycemia, cholesterol, and treatment of type 2 diabetes for patients with cardiovascular disease. More importantly, the groups are working more closely than ever to align guidelines for newer drug therapy classes. But could the generation of trials do more? EBDM Editor-in-Chief Dr. Robert Gabbay says yes, writing, "With so many therapies demonstrating a cardiovascular benefit, the time has come to design studies with cardiovascular benefit as a new starting point so that the next wave of drug development can move the bar even further for patients with perhaps less of a leap in cost. Offering patients more choices earlier on before diabetes does irreversible damage will create value for every stakeholder in the system." For the full issue, visit AJMC.com. For all of us at the Managed Markets News Network, I'm Laura Jost. Thanks for joining us.